So we're going to be looking at equality, diversity and inclusion in health and social care. This unit itself has 4 learning outcomes, which we'll be looking over the next few days. So you've got learning outcome 1, which is understand diversity, equality and inclusion within the workplace. So we're going to focus on that today. Learning outcome 2 is understand the development of systems that promote diversity, equality and inclusion. Then learning outcome 3 is be able to promote diversity, equality and inclusion. And then learning outcome 4 is understand how to manage risk and balance rights with duty of care. So for what we're looking at today, learning outcome 1, there's 4 assessment criteria here. So I'll just go through those. 1.1 is define the terms equality, diversity and inclusion. 1.2 is explain the legislation underpinning diversity, equality and inclusion in health and social care sector. 1.3, explain the models of practice that underpin equality, diversity and inclusion. And the last one, 1.4, is explain the impact of barriers to equality, diversity and inclusion. I'll just make this a bit bigger. So the aim of this unit is to help you to develop strategies for implementing and leading excellence in practice in respect of equality, diversity and rights in a health and social care setting. So you'll be very familiar with equality and diversity from the setting that you're in at the moment. It's a big thing. It's something that we all follow on a daily basis without even realizing it, to be honest. So for the first section, 1.1, define the terms equality, diversity and inclusion. We're just going to look at what these actually mean. So when we look at equality and diversity, that is the term that is used instead of equal opportunities now. Now, there's actually a legal obligation to protect against any discrimination. So depending on what your race or religion is, what your sex is, what sort of belief you have, you're all protected for that. So as a little cap, equality means equal rights and treatments to all individuals, and diversity means the difference from what is normal or expected. So for equality, we need to be able to promote equality for all, give every individual a choice. So let them be able to reach their potential without the worry of being prejudiced or discriminated against because of whatever their beliefs might be or what they might look like or how they might talk. So equality is just to make sure that you're giving everyone the same right and respect as others. So you're not treating younger people better and older people worse. You're treating everybody fairly. You're treating them as individuals and you're giving them support. You know, within healthcare especially, you're expected to make sure that you treat all of your service users equally. So it doesn't matter if they've got a different cultural issue. They might want a female, employee looking after them rather than a male employee. But it doesn't matter. You need to be there to make sure that you're actually respecting their rights and giving them what they want.
Yeah.
Then we've got diversity. So diversity, even though you're treating everyone equally, you need to understand that people are different. So, you know, you need to value their differences. You just try and make sure that you're celebrating their differences. Doesn't matter whether or not you might agree with what a certain person's thoughts and processes are. It's just to be respectful and dignified. So it's to appreciate all the differences between people, you know, respect their values, beliefs and cultures and their lifestyles. Give them the support that you can. Treat them as individuals and make sure that you work with them in a non-judgmental way. So like I said, it doesn't matter. There's some things you might not agree with, some things you will agree with. That's regardless of whatever your own beliefs are, you need to try and treat everybody equally. And then we've got this little section here just about what diversity is about. So, you know, diversity is about respecting individuals. So you respect their race, culture, their origin, their region, their gender, their sexual orientation, their values, their family structure, disability, so you're expecting them on all of these aspects over here. Then we've got inclusion. So this is the practice of, providing equal access. So giving them everybody the same opportunities, having the access to the same resources for everybody. So, there might be some people that you'll come across and you'll be like, oh, I don't want to treat them. They shouldn't be included. Or this older gentleman should get treated first because he's elderly, he's been waiting. He's just walked in, he looks ill, but there might be somebody that has just been sitting there waiting for treatment for a little bit longer. So regardless of what their age is, make sure all religion is or minority groups are or physical abilities are, make sure that they're all included. So cater for everything. It's very hard, to be honest, when you're trying to do equality and diversity, make sure everyone's included. You're trying to do an uphill battle, really, to make sure that you're not offending anyone, trying to meet everybody's needs, looking at your own beliefs and values as well. So it can be quite a difficult process sometimes.
Well, what you were saying there is when you look at the world now and you look at the world in the way that it is and the way the people are to behave, a lot of people, they're in it for themselves. So when there's all these, like, I don't know, companies and stuff and they're advertising for people to work for them, you have to meet that certain criteria if you're not pretty enough or if you're not, you know what I mean? Because it's all about how much money people can make.
Exactly.
That's what it comes down to. It's all, everything's about money, isn't it?
I mean, there's meant to be policies in place, but to be honest, in the ideal world, they would get looked at and it would be like, oh, it doesn't matter what your background is, doesn't matter what your accent is like, doesn't matter what sort of history you have or what you look like. If you've got the skills, we'll hire you. But unfortunately, sometimes it's not an ideal world, like you're saying. And you're completely right. You do get discriminated against for certain things that you shouldn't be. Sometimes it's not your skills that are looked at, but then they start looking at you as a person. So I understand exactly where you're going on this point. So carrying on with this, so inclusion is a universal human right. So you have to be, the aim of inclusion is to be able to embrace all people, regardless of their race, their gender, disability, or any medical needs, to give them equal access and opportunities, get rid of barriers, and it's also the act of including someone or something as part of a group or a list of an organization. So inclusion is just to make sure that everybody is included, that everybody is able to access what they need and what their requirements are. So for this 1.1, all you're going to do in your essay is tell me what equality is, diversity is, and inclusion is. So it's nice and simple.
Do I have to put references? Because I know that anyway. You see, my brain. This is why I say about references. Like someone could say a word to me, like I don't know.
And then you'd have them. Yeah.
I mean, yeah, and then I can go into like a half-an-hour speech about a clock. So like equality, diversity, and inclusion. I know I don't need references because I live it. I live it every day. I see it every day.
Yeah. So to get over that, I've got references at the end of the slide because some of the information that you'll probably end up adding in will be something along these lines anyway. So just add those references I'll show you where the slide is right at the end. And if you ever search anything on the internet, doesn't matter whatever it was, just copy and paste the bar at the top, and that'll be a reference as well.
Okay, no worries.
Yeah, but I know that a lot of the stuff that you do, even if you've got like 4 or 5 references, that'll suffice. Normally in my PowerPoints, I have about 5 or 6 in them anyway, so you could probably get away with it by doing that. Just copying and pasting those in.
Okay, no worries.
So for 1.2, it's explain the legislation underpinning diversity, equality and inclusion in the health and social care sector. So we know that legislations have been set in place to try and make a set procedure, have like a uniformity of wherever you are, what sort of organization you're in. It's just to make sure that everybody is, they're supported and they feel that they've been supported in the correct way. There's legislations there also that if you feel that you've been discriminated or treated unfairly, that you can look at and you can gain support from. So we've got the Human Rights Act of 98, and this is a critical legislation. So it has provision in the areas of discrimination, mental capacity, sexual offences, and information legislation. In the health sector, you need to have the ability and the duty to promote diversity and quality across your whole area. So just to make sure that you're respecting people's individuals' beliefs and values and cultures and lifestyles. It doesn't really matter of where they're from, what they're doing. You just need to try and respect their needs and differences. So we come on to the Equality Act of 2010. This means to treat people with fairness, and it's unlawful to treat people differently because of their gender. So everyone needs to be treated equally. It's also to ensure that every person in every organization has the same choices and opportunities, and no one should be treated differently. And it's also there to protect people from abuse. So it's there to, help people to promote compassion and dignity, and to try and make sure that you've got the best decisions in place for vulnerable individuals. Then you've got the Mental Capacity Act of 2005, and this means to protect an individual who's vulnerable, who might not be able to decide on their care or their treatment by themselves, or they might have learning disabilities, autism, dementia, they might have a brain injury. So it's there set in place so that they can get the care that they need in an informed way. So this act also makes it clear about who can make decisions and how they can make it, especially if the individuals can't do it themselves. So if there's an individual who might be having a family member making decisions for them, but it's not in the best interest for them, this act will help the caregiver to make the right decision so that they're able to protect them from abuse. So we're coming back onto the Human Rights Act. So it sets out to protect every individual. It gives every individual the fundamental right and the power to challenge discrimination. So this goes into safeguarding. This applies to all aspects of the human rights, so they're central to the healthcare profession. And they're just there to make sure that if there's any incidents or any issues that have happened, they're getting reported and handled in the correct way. Under the Human Act, people have the right to life and protection, and they also get day-to-day support is offered to individuals from carers. So you might have somebody who needs a personal hygiene support, or they might need some support with eating and washing, or you might have to have a confidential discussion with somebody. All of this falls under the Human Rights Act. Then we come on to the Health and Social Care Act of 2010. So this act establishes the equality of duties for the public sector, and it's quite a good act, this one. It gave individuals a voice in their care. This is where person-centered care came about from. So the Health and Social Care Act has also introduced a way that the NHS is actually governed, is measured, they've got an accountability against this act. So this will make sure that things are being run the way they should be. Then we come onto the Care Act. This is the last slide for 1.2. So the Care Act is just about the local authority. It helps to assess people's needs and their eligibility, how much care they need, what sort of support they need. They'll carry out assessments for anybody that needs care or support. They'll assess a person's needs, their well-being, and also they'll speak to the individual as well. It's not just about somebody coming into your life and saying, we're going to do A, B, and C. It's your choice as well. What can you realistically do? How can you realistically support yourself or support the person that is, are the things that the health professionals are saying to you, are they doable? Can you actually carry out those tasks that they've been telling you to do? So the actual individual, the service user, gets a voice in here as well.
Yeah.
And then also, it'll provide access to independent professionals, so you can support any type of personal involvement. You can get their opinions, so you can have an independent coming in from the outside, seeing, are you getting the right type of care, or are you giving the right type of care here? So that was 1.2, just a few bits about legislations, Mental Care Act, Human Rights Act, Health and Social Care Act, and the Care Act. Do you have any questions or anything you'd like to say?
No, that's good. I'm not actually writing it down, you know, like I did last time, because what I'm going to do this time, I'm going to go back over it. So there's a lot of people walking past and stuff, and they're trying to do, like, tell me stuff, and I'm trying to, you know what I mean? So rather than, so I'll just go back over it later, and then I'll take the notes down.
I'll email this recording to you, and also you'll have this on the Moodle on the website. The PowerPoint is on there, so you can still go back and just look at whatever you need to on there.
No.
So on to 1.3. So explain the models of practice that underpin equality, diversity, and inclusion. So you're probably aware of, there's a million different legislations and policies and procedures that are there. Now, these are some of the ones that support equality and diversity and inclusion. So you've got the Sex Discrimination Act, Race Relations Act, Disabled Persons Act, Education Act, Childcare Act, Discrimination Act, and the Special Educational Needs and Disability Act, along with the overall Human Rights Act.
Yeah.
So here are so these are just some points that I've pinpointed that are good terminology for you to use within your assignment. So we're going to look at valuing differences and treating people fairly. So when we look at all public bodies, regardless if they're healthcare or business or school, whatever they are, they need to think about treating people fairly and equally. It doesn't matter about what group they're from, they need to be treated fairly and equally. So this is called the equality duty. Now, the equality duty is a law for public bodies telling them that they must think about how they can make their support and how to make sure that they're supporting their individuals within the organization, how they're supporting that equality. You know, for example, in services, how are they supporting them in their jobs, how are they supporting them, how money is spent, how are they supporting them in, say, medical care, depending on, or even in their education, depending on what the organization is, they've got to make sure that they're supporting them in the adequate way. So when we look at public bodies, again, public bodies are just like a health. It can be a doctor, it can be the NHS, it can be a school, it can be an organization, anything. So public bodies already need to think about treating people of different races, disabled people, and men and women fairly and equally. So again, this is equality duty. So within this, you've got people of different ages. You've got lesbian, gay, and bisexual people. So the duty now fully covers people who have changed their sex or in the process of doing so, people with the religion or belief, and women having a baby or women who have just had a baby. So we've got a couple of examples. Yeah?
Obviously, my belly's in bits, you know. What's it called? There's things, obviously, that, no, that I disagree with. Like obviously, like now, you know, they give children razor blades so they can cut themselves cleanly and stuff like that. You know what I mean? And obviously abortion and stuff like that. You know, the things that I, you know, that I don't agree with. It's, I mean, they shouldn't be giving razor blades to nobody.
Yeah, I've not heard of I've not heard of the razor blade because I know cutting is a big issue, and personally, I've not heard of that, and I will look into it. With abortion, I think it comes under Human Rights Act. It's about, you know, having the right about how your body works and what you do with it. And there are some things that with abortion I do agree with, especially if there's been a situation where if somebody's had something done to them by force and things, I do understand why those would happen. So, yeah, again, the beauty of this is that even though we might have different, like there's things that you believe in and there's things that I believe in, and I might not agree with some people about certain things, and you might not agree with some people about certain things. But if you're in a care centre and a young girl has come in and she's having an abortion, you're not going to sit there and you're not going to tell her off, or you're not going to chastise her, are you?
No.
Exactly.
Everyone's got free will. Everyone, just because I don't agree with something doesn't mean that I'll say, do you know what I mean? That's just my, you know,
I understand.
You help everybody you can, you know.
Exactly. I mean, that's the thing that, you know, you're educated enough, you're compassionate enough to understand that there are some people out in the world who might be working in healthcare, who might be working closely with young children who don't understand that, and they need these policies and legislation set in place just to make sure that they're following a standard procedure. So that is trying to just develop compassion and respect and dignity is the whole point of this.
I mean, there's a place in where I'm living in Hartlepool. There's a place in Stockton, I think it's Stockton or Middlesbrough. Yeah, it's close by anyway. And heroin addicts now, they can go to this place and they inject them with this stuff twice a day, and it's just the strongest heroin, and it stops them from actually. So what they're doing now, they're promoting, because they're not helping people to get off the drugs, but that's how they're coming across. But what they're doing is they're keeping people bound up on the drugs. You know what I mean? And there's loads of stuff like when you look into, well, for me personally, and I think, wow, how can they do that, and how can they say this when it's actually, you know, it's misinformation, or it's fake. You said last time it's fake news. No,
I understand, because from your point of view, you're saying that they should try and rehabilitate those persons, try and wean them off, rather than not replacing one drug with another drug instead.
With another,
Yeah, because you're going from one dependency to another.
Acceptable.
Yeah. Unfortunately, that's just the way the world is. It's not ideal. There's a lot of things going on which you wouldn't agree with, but there's so many things that are classed as acceptable that you think, really, how can that be like that? But yeah.
Okay. So, just go off.
Oh no, it's okay. So coming on to here, I've got a couple of examples of how this equality, diversity and inclusion might work. So if you've got a park, you might want to put extra seats in a park so older people can enjoy them as well as young people. So for lesbian, gay and bisexual people, the school might do more to make sure that the children are not bullied. So you might not, want to point certain things out. Or I've worked in school for many, many years, especially within primary schools a good few years ago. And there were situations where whatever you say as a staff member, as a person, as a role model, if I go and say, oh, she's got two mums, or oh, he's got two dads, the other children are going to pick up on my disconcern. They're going to pick up on how I'm speaking, and they're going to adapt themselves to please the person that's a role model. So you've got to really watch what you say, especially when you're around impressionable people, just to make sure that you're leading them down a certain path.
Yeah. I was going to say, just sorry for keep butting in. What you just said then, it's this is what I was saying in the communication. Like, we speak life or death into every situation, and we don't even realise it, because you could say something, or you could say something and hurt that, and then that has an effect on that person's day, and how that person's day then shapes based on how we communicate with one another. Shapes that other person's day, because they might feel good off what you say, or they might feel bad off what you say, depending on how you're coming across and how you're saying it and what you're saying.
And sometimes it can be such a small thing that you say which makes no effect to you, but it's made a very big effect to someone else. So you're perfectly right in saying that. We've got one more example of how the Equality Act works. So you've got, for example, older people and younger people paying, if they were to pay money, obviously within the NHS, there's free services, but if there are some services that are being paid for, they're going to be paying the same amount as each other. So they're not going to be saying you pay more because you're older, you're more at risk, and you can pay less. Older people getting the same care in the hospital as younger people. And just to make sure that people that have, regardless of their age, that they're getting the same sort of equality. Now, we know that there are some things that like older people will get free bus passes, or they'll get flu injections. It's just that they're more at risk for certain things. But then again, you've got the same sort of travel passes or discounted rates for younger persons as well. So it just sort of like pull itself out. So our next point for here is ensuring a positive working and environmental culture. So as a caregiver, you're supposed to be able to heal and give comfort to people who are sick or injured, or just to be there for them, to be honest. As a medical professional, as a caregiver, you're giving care to people who might be having the worst time of their lives. They might have had the worst decisions, worst news given to them. They might be upset. They might be worried financially. So they're very vulnerable. So you're there to make sure that you can help them and support them in whatever way you can. So you've got some healthcare professionals who aren't satisfied with their work environment, who dread coming to work and only show up to get a paycheck or only show up to, get paid and things, but they don't give this type of care that patients expect or need. So that's a bad environment that you're working in, because if you're not happy about going to work, if you're just going through the motions, then you're not going to give that same sort of support and be as compassionate as you would need to be as if you're happy about being in work. So there are some ways to promote a positive working and environmental culture. So know how to give and how to take feedback. Now, when you get feedback, it's not somebody criticizing you. It's somebody that's actually just looked at something. They've realized that there might be a step that can be made a little bit better, and they're just helping you to fix maybe a mistake or, fix something that can save you time. It's not because they don't like you, and they're not telling you because you're not their friends or anything. It's just to help you improve yourself. Also, when you're giving feedback, try and do it in a positive way. So make sure you're doing it so you feel like the person that you're talking to is being helped and they don't feel like they're being told off. So consider different perspectives. So just because you know how to do something doesn't mean, and it's something that you've done for years and years, doesn't mean there's not another way to do it. So if somebody gives you their opinion or a perspective, just listen to them. Maybe it's something you want to adapt. Maybe just listen to them and still carry on doing things your own way. And then safety first. So it's good to be considered honest and respectful, but you also need to be reliable too. So in any sort of medical field, any failure when it comes to safety can endanger the health of your patients. So you need to make sure that you're filling out your records correctly. You're not leaving things lying around that can be harmful. So just be aware of the hazards around you. And again, when you're at work, you don't want to be going there and be stuffy and boring and just go through the motions. You want to go, you want to have a laugh, you want to have a bit of a gossip and a chat with your co-workers. It makes your day go much, much easier. So be considerate, empathize with your colleagues, share your tasks, share your knowledge, work together. There might be a time when you're not feeling well and somebody else might step up and do a little bit more work than normal. Then another day you'll return the favor and you'll be like, right, you looked after me when I was ill, I'm going to look after you now. And then you just work together. Then we have the equal opportunities approach. So this principle is that everybody is entitled to equal opportunities from any public care system. They get equal opportunities for everyone, patients, staff, family members, and they get some of the points that they get equal opportunity for more. Are care, medication, training, information, access, and there's a million other things out there. And then you come on to diversity and inclusion in healthcare. So to make sure that you're giving quality care and positive outcomes for all of your patients, it's very important that you address and manage diversity and inclusion within your care setting. There's a lot of implications to diversity and inclusion and the impact on the moral, the quality of care, the cost of patient attrition, and the healthcare disparity. So you've got a lot of points that you're looking at here. So you've got to try and create a culture with no tolerance, so no bullying, no looking the other way if you see something that that shouldn't be happening, it needs to be addressed. So you need to plan and practice, and you need to make sure that there's positive interaction set in place. So that was 1.3. So just we looked at a few bits of how we can practice equality and diversity in healthcare. Then we'll go on to the last point. So it's 1.4, explain the impact of barriers to equality, diversity and inclusion. So when we're looking at this, we're just going to look at what sort of barriers there might be to this. So you've got discrimination, poor quality of care, being provided with the wrong services, given the wrong medication. You might not be given a choice. You might be feeling isolated. You might be distanced from your families and friends. You might feel lonely. If you're trying to navigate through a hospital, you might have, if something has been signposted wrong, if the directions are wrong, you're going to be wandering around and getting confused. So incorrect signposting. And then lack of resources. You might not have the special equipment that you need. You might not have interpreters to help you converse with your patients. So all of these are barriers. We're just going to look at the impact of structural barriers. So structural barriers can cause significant problems with health screening programs. So you've got things like low priority can be given for certain health issues or treatments. So if somebody's got diabetes, they might have a lower priority to somebody that has cancer. You've got restrictive regulation on medication. So some people might be able to access medication. You might not have enough funding for it. It might be a requirement where patients have to pay for the medication. They might not be able to afford it. There might be an availability of treatment. So a treatment might be available, but you might not get an appointment for a very long time, or there might be a limited amount of people that can actually get that treatment. And then again, structural barrier is staffing issues. You might not have enough people on the floor to work. Then you've got physical barriers. So physical barriers exist in a structural environment that interferes with or impedes a person with a physical disability from accessing a particular location. All this means is something that stops somebody with a physical barrier accessing where they need to go. So you might not have any wheelchair access. You might not have lifts. You might have stairs leading to treatment rooms. If somebody's in crutches, how are they going to get up those? You might have steps or curbs that block people going up and down and entering the building. They might have a mobility impairment. You might have mammography equipment, where you do those breast exams for breast cancer. And if somebody, it might require the woman to stand up, but if the lady has a mobility impairment, how is she going to stand up? How is she going to access that equipment? Then you might have, you could have absences of weight scales. So, if you're doing healthy weight screening for someone and you want to check if they've lost any weight or how the progress is going, if you don't have something simple as a weighing scale, so how are you going to do that? Or if you do have a weighing scale that has a little step on it, that you can't have a wheelchair going on the top of it, it's going to be an issue again. Then you've got the impact of prejudice, values, beliefs, and attitudes. So again, this can lead to inaccurate or incomplete conclusions. So it can harm your relationships. So depending on what your own personal beliefs and attitudes are, sometimes it can colour how you look at other people. So in mental health and in care settings, prejudice can undermine client care. So even if the provider is unaware of their own prejudice, it can sometimes colour how you speak to them. Prejudice can also be based on a group status, so such as gender, immigration, generation, your ethnicity, your religion, and so on. And then finally on this, for values and beliefs and attitudes, they can influence how the organization works and also how you work as well. So it can, it depends on what your culture is, what sort of care and compassion you have. You need to reflect on and be aware of your own personal values. So when you're within the setting, you need to understand what your own values are, what your own beliefs are. Be confident in those, but then also don't let that impact on your attitude and your relationship with other people. You might have a friend that you get along with really well. You like watching football together, you like going to the pub together, you like talking to each other. But when it comes to religious views, you might be completely different views to each other. But that won't affect you from hanging out or being friends with it.
No.
And
see, everything you've just said there is absolutely spot on, and it doesn't matter like what somebody's opinion is, or just because you've got a friend that supports Man United and you support Manchester City doesn't mean that you're going to treat that friend any different than you treat any other friend, or not speak to that friend. You know what I mean? It's just your views. It's just that's how it.
Exactly.
I get
Yeah,
it.
that's true. I understand that. Yeah. So on here, you can have exactly what you've just said now. You can have different values, different beliefs, different attitudes, but it's not going to impact on how you talk to your friend. It's not going to impact on how you talk to your patients or to people around you. You're comfortable in what you're doing. You know what your beliefs are, but you're also comfortable enough within your own beliefs that you know that listening to somebody else or supporting someone else isn't going to put you down. It's not going to make you less of yourself. You're going to be more of a person when you can embrace other people and you can actually support them regardless of whatever your own cultural beliefs are or what your own attitude is. And when you do that, it'll help you to stop miscommunication. It'll help get rid of ill feeling as well. So that was it for today. So as a recap, we've looked at equality, diversity and inclusion, what they mean. We looked at a few legislations like the Mental Act. We looked at the Mental Care Act, the Health and Social Care Act, Human Rights Act. Then we looked at some things that underpin equality, diversity and inclusion. And then we looked at the impact of barriers. So I'm just going to turn the recording off.